What is the primary mediator released by mast cells during an allergic reaction? Watch this video to find the answer. Welcome to Dr. Exam Questions and Answers. In this video, we'll present some real MCQ, real essay questions and answers for pathology. Before we start, you are all encouraged to like, to comment and to subscribe to my channel so that you do not miss any future videos. What is the distinction between cellular injury and inflammatory response in terms of their underlying mechanisms, morphological characteristics, and clinical importance? Well, in this question, which is 10 marks, you have to talk about cell injury. Well, cell injury refers to the damage caused to cells which disrupt the normal structure and function of the cell. It can be reversible or irreversible. Now, hypoxia, toxins, infections, and trauma are some of the causes of cell injury. Cellular injury is characterized by swelling of the cell, damage to the cell membrane, and denaturation of cell proteins, including cell DNA. Cell injury can lead to cell death, which can be apoptosis or necrosis. It can also lead to adaptation and recovery. Now, what of inflammatory response? Well, inflammatory response is actually a complex biological response to tissue damage or infection involving immune cells, chemical mediators, and blood vessels. In addition to infections, tissue damage, autoimmune disorders, or allergic reactions are some of the causes of inflammatory response. Inflammatory response or inflammation is characterized by increased blood flow, vascular permeability, and infiltration of immune cells, which will lead to redness, swelling, heat, pain, and of course loss of function. Now, the aim or the purpose of inflammation is to eliminate the initial cause of tissue damage and bring about resolution or tissue repair. The next question: which of the following best describes the term fibrosis? A. The replacement of normal tissue with granulomatous tissue. B. The thickening and scarring of connective tissue. C. The shortening of muscle fibers due to injury. D. The formation of fluid-filled cavities in tissue. The answer is B. What is the primary mediator released by mast cells during an allergic reaction? A. Histamine. B. Prostaglandins. C. Cytokines. D. Leukotrienes. The answer is histamine. A. Compare and contrast chronic inflammation with acute inflammation, highlighting the differences in their underlying mechanisms, clinical manifestations, and disease outcomes. Where about acute inflammation, which is a short-term, self-limiting inflammatory response to tissue damage or infection. This acute inflammation is caused by bacteria, viruses, tissue injury, Even chemical exposure can also cause acute inflammation. Acute inflammation is characterized by rapid onset, localized, and then it resolves once the underlying cause is eliminated. The consequences of acute inflammation include resolution, tissue repair, or acute inflammation can progress to chronic inflammation. What about chronic inflammation? Well, chronic inflammation is not a short-term but a long-term persistent inflammatory response that can lead to tissue damage and disease. Chronic inflammation is caused by persistent infections, by autoimmune disorders, or even exposure to toxins or toxic substances. Chronic inflammation is characterized by slow onset, not rapid, but slow onset. It is diffuse and can last for months or even many years. The consequences of chronic inflammation include tissue damage, organ dysfunction, and it can even increase the risk of chronic disease like atherosclerosis or even cancer. The next question: which of the following processes primarily contributes to the formation of a fibrin clot in response to tissue injury? A. Vasodilation. B. Coagulation cascade. C. Phagocytosis. D. Cellular recruitment. The answer is B. Coagulation cascade. What are the three main events that occur in tissues during acute inflammation, and how do these events contribute to the inflammatory response? Well, the answer: the three main events or the three primary events that takes place in acute inflammation include hemodynamic changes, increased vascular permeability, and also immigration of leukocytes. Now, hemodynamic changes is the initial phase of acute inflammation that involves changes in blood flow, vasodilation, leading to redness and warmth. Following the hemodynamic changes, the permeability of capillaries, venues, and other blood vessels rises. These allow plasma proteins and white blood cells to leave circulation and then to enter the affected tissues. These white cells, particularly neutrophils, they move to tissues by adhering to their endothelium, and then they are going to migrate toward the site of injury in response to chemical signals. Yes, they are now at the site of injury. These white cells, like neutrophils, they carry out now their function of engulfing microorganisms and also the release of cytokines. Which pathophysiological process describes the increase in blood vessel permeability that occurs during inflammation? A. Vasoconstriction. B. Exudation. C. Transudation. D. Hyperemia. Well, the answer is B. Exudation. How do the three main events of acute inflammation interact to facilitate the body's response to injury or infection? The first main event is hemodynamic changes. So here, blood vessels, these are capillaries, venues, arterioles, veins, and arteries. These blood vessels undergo vasodilation. This will bring about increase in blood flow to the affected area. This process enhances the delivery of immune cells and nutrients necessary for inflammation. The second main event is the increased vesicular permeability. So following changes in blood flow, the endothelial cells of blood vessels become more and more permeable. This allows plasma proteins, including immunoglobulins, antibodies, and clotting factors, as well as white blood cells, yes, leukocytes, to leave the bloodstream and then to enter into the tissues. The leakage of these components will contribute to bring about the characteristics of edema or swelling that we see in inflammatory response. The third main event is leukocyte immigration. Activated leukocytes, particularly neutrophils and later on macrophages, they are able to adhere to the endothelium and migrate through the vessel wall into the surrounding tissue. This immigration is guided by chemotactic signals which are released at the site of injury, allowing more leukocytes to reach and to neutralize pathogen, to neutralize infectious organisms effectively. At the same time, also clean up cellular debris and promote healing. So you can see the interplay between these three events ensures a swift and localized inflammatory response, which is essential for combating infections. Yes, for combating infections and initiating repair of tissues. Mediators such as cytokines and arachidonic acid derivatives, they are there to coordinate these responses, underscoring the complexity and efficiency of the acute inflammatory process. What type of necrosis is characterized by the transformation of tissue into a caseous, cheese-like appearance? A. Coagulative necrosis. B. Liquefactive necrosis. C. Caseous necrosis. D. Fat necrosis. Well, the answer is C. Caseous necrosis. Which of the following cytokines is primarily responsible for the systemic effect of inflammation, such as fever? A. Interleukin 6. B. Tumor necrosis factor alpha. C. Interleukin 1. D. Interferon gamma. The answer is C. Interleukin 1. Which of the following is a characteristic feature of acute inflammation? A. Presence of lymphocytes. B. Presence of neutrophils. C. Granuloma formation. D. Tissue fibrosis. The answer is B. Presence of neutrophils. Thanks very much for watching. We've reached the end of our video. If you've liked it, please like, comment and subscribe to my channel so that you can watch future videos.